THAVASEELAN IAS CEO of Nagaland Health Protection Society bra NLTV logot koda Korea homoide dai bra koishigi NHPS bra Nagaland Health Scheme AB-PMJAY aro CHMIS deliver krule khas role play kuriase. Nudun health drive pra manugun kan itiatak scheme laga under de shamil thakya nai dai kan ge bi shamil krubo aro beneficiaries laga card punaule moto dibo scheme laga la pawule. Previous insurer future Generali India insurance logode thakya issues kan sob resolve kurdisha aro May 2025 pra loikina Reliance General Insurance to nutun partner huishi June to pra private hospitals ke register aro Re-Empanelled kuriase services delivery palbra function kurule hospital empanelment laga nutun system version 2.0 de paperwork to bishia ze tunimide all of diri luase hulibi suspended private hospital kando itu hafta bra wapas shamil kuri dibo sarkar insurer aro hospitals laga page ekta nutun MOU sign kurubo scheme to palbra chulawle.
Today we are here at the Nagaland Health Protection Society office to talk about the healthcare drive that has been launched recently under Ayushman Bharat and Chief Minister Health Insurance Scheme. And Sir CEO Sir THAVASEELAN is here with us. We'll know more about the details of this health drive that has been launched on 15 June and that will be continued on 30 of this month. And Sir, as we all know that the Nagaland Health Protection Society has been actively involved in launching and strengthening the healthcare initiative in Nagaland, particularly through this Ayushman Bharat and Chief Minister Health Insurance Scheme. Sure. So on launching of this health drive under Ayushman Bharat and CHMSI in collaboration with the Ministries of Tribal Affairs, can we know more details on regard to this health drive that has been launched?
Sure. So the Ministry of Tribal Affairs, Government of India has launched a nationwide awareness and saturation campaign in celebration of what it's called the Janjatiya Gaurav Varsh 2025. So between 15th to 30th of this month, the idea is that the awareness and saturation campaign has been launched with the idea of saturating and delivering individual entitlements to every person across the country, specifically where there's a lot of tribal population. So the Ministry of Tribal Affairs is anchoring it at this point in time. So we are at the state level, we're working alongside the Department of Tribal Affairs. So we having a special statewide drive for both the AB-PMJAY and CHMIS. It has two purposes. One is card generation and registration for those who've still left out and who've not gotten their cards made. And awareness building through community outreach. That's another important component of what we're doing as part of the 15-day campaign. So, obviously at this point in time, we already have a system where if someone does not have a card but is entitled to have a card, they can, he or she can get the card made at the hospital itself. There's a green line, a green channel through which they can get it made. So this campaign was launched officially on 16 June as yesterday in 4 districts: Mokokchung, Seminyu, Longlang and Zuluboto. The rest of the districts are rolling out today. So the Department of Tribal Affairs in our state has identified 608 villages across all districts. So the data that was given to us, based on that, the Nagaland Health Protection Society has prepared district-wise micro plans, camp calendars, and we'll be monitoring the progress of the activities over the 15-day period. So that's broadly it. The idea is to ensure that whoever is left out and doesn't have a card gets a card done, and further increase awareness and outreach amongst the people so that they're aware of all their entitlements under AB-PMJAY as well as CMHIs.
Sir, so during this health drive, what was the target or to be enrolled or during this health drive, especially in the village in the state of Nagaland?
Sure. There's no specific number that we're working with, but we wanted to ensure that everyone who doesn't have in those 608 villages, whoever has not gotten their card so far should get registered and get their card. So that's the whole idea. And an equally important part, like I mentioned, is to ensure that people are made aware of their entitlements under the scheme. So the list of hospitals that are empaneled, what are the various treatment options that are available, how much like if it's AB-PMJAY, it's a 5 lakh rupees cover, and CMHIS general is also 5 lakh rupees cover, and for CMHIS employees and pensioners it's 20 lakhs. Beyond 20 lakhs the state government would reimburse, and for pensioners it is a 20 lakh cover. So that entitlement also, so that they're aware of it sufficiently.
So, sir, coming back to this Ayushman Bharat and the Chief Minister Health Insurance Scheme, in the state of Nagaland, we know that at the present, this scheme, Ayushman Bharat and Chief Minister Health Insurance Scheme, has been, implementing only in the government sector, in the government civil hospital, whereas the empaneled private hospital that has been suspended in the month of April. So how far the Nagaland Health Protection Society has been taking up the measure to improve on this scheme coverage?
Sure. So we had this issue, there's an ongoing issue with the future Generali insurance firm, which was the insurance firm for the previous financial year. The whole month of April, we ran it in trust mode, as in the government directly implemented. And from May onwards, we have a different insurance firm, Reliance General Insurance Company. So now we are in the process of getting the hospitals on board. The process is already on. Several hospitals have given their interest to come on board again. And we are, so there's something called the hospital empanelment module, which has been developed by the National Health Authority. So earlier it was the 1.0 version, now it's a 2.0 version. So the hospitals are taking a bit of time in terms of completing the documentation and paperwork. But the first set of hospitals, the private hospitals which are suspended, they will be on board hopefully within this week, or worst case another 10 days. So post which we'll get more and more hospitals. So they have to submit several information like the doctors who are working there, the various specialities that they have, the details of the infrastructure that they have. It's a very comprehensive portal where several pieces of information have to be submitted. So that's taking a bit of time, and also we'll be signing new MOU with them. It's going to be a tripartite agreement for the hospitals within the state, between the state government, the insurer, and the private hospitals. But we hope to have the first set of private hospitals back in the scheme implementation within another 10 days.
Okay, so sir, you have mentioned that the hospital has been coming in on the board for the new registration. So can you get the numbers that how many private hospital has enrolled on this board till now?
Portal. So they've expressed their interest. Right now the process is ongoing. So I can tell you in Dimapur at least 5 to 6 hospitals have expressed interest. Now some of the other hospitals they will come on board, but at a slightly later time. But the first set of hospitals, I don't want to name the hospitals at this point in time, but these were the private hospitals which were earlier providing services. They're coming on board right now. Once the process is completed, we should be our beneficiaries will be able to take services in these hospitals also. 2 to 3 hospitals in Kohima at this point in time. But as these hospitals come on board, there are more hospitals which will come on board as well. And we're also the Nagaland Health Protection Society is also at this point in time selective in terms of ensuring that the hospitals that come on board satisfy all the conditions that the National Health Authority has imposed in terms of the kind of specialities that are there, the kind of infrastructure that's needed. So we're ensuring complete compliance to that as well.
So, sir, the NHPS, has informed the public about the delay, this claim settlement issues and all.
Yes.
So, how's the Nagaland Health Protection Society
Sure.
has been, taking up the development for proper implementation of on this scheme?
Right. So I'll divide it into 3 parts. First is the previous financial year where the future Generali Insurance Company was implementing the scheme. Like I said, the insurance premium that they had quoted and how they had won the tender was about 92 crores. But eventually the claims that came in was 180 crores. So it was almost double what they had quoted as a premium amount. So they are in the process of making the payments. 114 crores have already been paid out to all the hospitals. The hospitals outside Nagaland, almost all the claims have been settled. Now the hospitals within Nagaland, both PMJAY as well as CMHIS, the claims are being processed. They've told us by the end of this month they will finish the complete claim processing. Of course, there are some claims which have been rejected, which we are again taking up with them to reopen because they may not have been rejected properly. This process we had a meeting with them in Chumukadima on 14th, this Saturday. So they promised that they will clear up the payments by 14th. In case they don't honor their commitment, we obviously have the National Health Authority, we have the Insurance Regulatory Development Authority of India Limited, the Department of Financial Services, who can intervene and get the needful done. So very hopeful that we will be able to close it by this month as per their commitment, even in case it spills over to next month, because a very large number of claims that have to be processed. We will ensure that the payments are made by them, whatever is due from their side, and the hospitals are the bills are settled.
So, sir, at present, how many number has been covered under this Ayushman Bharat and the Chief Minister Health Insurance Scheme in the state of Nagaland?
So, if you look at the overall numbers for last year, we had about, I'll look at PMJAY and CHMIS together, about 39,000 beneficiaries with a total claim payout of 180 crores. So a lot of times the question comes, right? I mean, where is the 400 rupees that's being deducted going? So the Department of Finance maintains a bank account with the Nagaland State Rural Bank where this money is deposited. So that amount comes to around 60 crores a year at this point in time, roughly. That is round about the figure. But the state last year had to pay a premium of 92 crores. The state is contributing over and above whatever is collected. And this year, for the financial year 25-26, the premium payment that the state government will be making is 149 crores. So that's much more than whatever is being deducted in the form of premium. So that's one thing that I want to, we would like to make it very clear to our viewers. The money that's coming in is being used to make the premium payment. Now, a lot of people have questions as to, so I pay 400 rupees, but then I don't get sick, I don't use the hospital. So how does it work? So it's very clear at that point in time that, so the whole concept of insurance is that you pay insurance premium, and then when there is a need, when there's a situation that someone has to access the medical services, they'll be able to get the payout. So that's how the whole concept of premium works. So it's not like someone who's paying a premium will mandatorily undergo a treatment in that particular year. So this is what we'd like to make it clear to your viewers, that the money that's coming in, that's being deducted in the form of 400 rupees, is being used to pay premium for the insurance coverage. So right now we have all the private hospitals outside Nagaland. We have a very large number in Guwahati, Delhi, in Kolkata, in Chennai, and several cities across the country. They're all intact. In Nagaland, because of this ongoing issue, the private hospitals had stopped services, and they'll be, but within another 10 days, we're very confident that they'll be able to complete the process. They've already given their interest. It's just the process is taking time because several documents have to be uploaded in the portal before they come on board. Once the private hospitals come on board, we'll have right now the CHSR plus all the government hospitals in the state, NHPS, and all the government hospitals are servicing beneficiaries. These private hospitals also will come on board shortly, and we'll be able to resolve the issues with the previous insurance company in terms of the payment. So during the trust mode for the month of April 2025, so the state government, since there was no insurance company at this point in time, our team, the NHPS team, is vetting every claim to ensure that there is no element of misuse or abuse. So, which is why it is taking a bit of time for the payments to go through, but payments are already happening, and we have enough money to cover all the claims. About 13 crores worth of claims came in the month of April 2025. We'll be able to make the payment. From May 2025, with the Reliance General Insurance company, which will be making the payment. So there's a process called the bank integration, which we using the portal of the National Health Authority. The bank integration is complete for CHMIS. For PMJAY, it is ongoing at this point in time. We hope to resolve it by today or tomorrow, post which Reliance General Insurance Company will also start making the payments for the claims starting May 2025.
Okay, sir. So this scheme aims to provide cashless health service,
That's correct,
to the beneficiaries both in the government, private, in and outside the state of Nagaland. So do we expect that this scheme will, implement properly, to benefit the beneficiaries, especially in the state of Nagaland in future, sir? Definitely.
I mean, if you look at the numbers, in the year 23-24, the payout was somewhere in the vicinity of 94, 95 crores. Prior to that, it was about 65, 70 crores. Last year, the payout, that's the benefits, that overall benefits that people have received, is about 180 crores. And it's only going to increase going forward, given the fact that with more awareness, more people will take services under these schemes. Plus, there's a medical cost of inflation. I mean, the healthcare services, the cost increases year on year. So we are very, very positive that the scheme will continue to benefit several thousands of our people every single year. But there's also one concern that we'll also have to look into it. There have been instances where we told that some beneficiaries have insisted that they be admitted to the hospital so that they can claim benefit under the scheme. So this particular scheme, if you're an outpatient, you just walk in and take your treatment, you're not eligible for any coverage under the scheme. But there have been instances where we've been told that beneficiaries insist that they get admitted so that they get benefits under the scheme. So that's something that we're actively emphasizing that our beneficiaries don't do. Of course, a very small number of people, not a large number, but that would lead to defeat of the scheme's purpose, because it's meant for people who actually need it on the ground. The other thing is there could be some instances where there could be instances of overbilling, where instead of slightly lower grade of medicine, a higher grade of medicine may have been prescribed right away. There could be some instances like that. So which is why we are at NHPS, we're looking at all sorts of solutions. We're working very, very closely with the hospitals, we're working with the insurance company, we're working with the beneficiaries, A, to increase awareness, and B, to ensure that no stakeholder in the system misuses or abuses the scheme. So that's something that we're working on. We're also deploying artificial intelligence or machine learning algorithms to see if there is a way for us to segment people and take up steps so that they don't even have to go to the hospital. So we look at people who are high risk, people who have existing conditions, people who are most likely to need coverage under the scheme, and see if we can come up with interventions that result in them not even needing hospitalization. So that's one part of it. And then during the period of hospitalization, how can we, so if a person goes with a particular ailment, then we know that this is typically the expected length of stay. If for that particular treatment or that particular ailment, if the person stays for a much longer period, unless and until it's something that's genuine, there could be a case of a case where some overbilling may occur. So we're trying to arrest that as well. And then post-discharge, what we're also trying to do is we are working with our team here, our call center team. Plus, also we're making use of community health officers, ASHA workers, Anganwadi workers. This is something that we've started just implementation right now, to follow up with these people and ensure that they follow all the steps prescribed by the doctor. They take all the medicines, they follow the kind of lifestyle that's advised, so that they don't have a repeat hospitalization. Because we see that once someone comes in for repeat hospitalization, the amount of payment that claim incurs is much more than the original initial hospitalization. So we're taking all possible steps to ensure that this scheme remains sustainable. And so I think that's what I mean. It's like ensure that there's enough money to pay the premium going forward as well, because the premium is only going to keep increasing. The state government is already taking shelling out a lot, much more than what is being collected in terms of the 400 rupees deduction that's happening to service the scheme, and we are positive that the scheme will grow by leaps and bounds in the years to come.
So, sir, what will be your last message that you want to give out to the viewers? That since you have mentioned that within 10 days, that private hospital, Empaneled hospital will be coming back to, to be on the board for registration and to start as a usual of this scheme to be implemented properly. So, what will be your reports?
So, the thing is, we're grateful to everyone for being patient, because we had a situation that we did not encounter, we did not anticipate. So, with the dues from the previous insurance company being paid paid out, and we will ensure that it's completely cleared. Once the hospitals are on board, our request to all our beneficiaries and all our stakeholders is to use the scheme judiciously, so that the people who are in most need of help get the help. Please reach out to a toll-free helpline number. We keep advertising it in multiple fora. We would request you to kindly do that, so that if there's any issue where a hospital charges you money or it's not providing cashless services, you can report it to us. If you face any difficulties in terms of if your card is not getting registered, or if you don't have a card but would like to make a card, please reach out to us through our email, or we have a toll-free number that's available 24/7. We'd request you to reach out to us, so that there's a WhatsApp bot as well. You can just send a WhatsApp message and someone will respond to you. Let us know if there's any problems that you're facing, and please help us make the scheme a success.
Nagaland TV, Sob Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.